Hello, it's Tim here, one of the physiotherapists at Goulburn Physiotherapy Centre. Today I'm going to provide you with some information about why completing pelvic floor exercises is so important before having any prostate surgery. To begin with, let's understand some of the anatomy associated with urination and what the prostate gland's involvement is. The prostate gland is a structure made up of both muscle tissue and gland tissue and is located beneath the bladder. The tube that carries urine from the bladder through the penis is known as the urethra, and it runs directly through the prostate gland. A ring of muscle tissue in the prostate gland acts as an involuntary sphincter, which means that it contracts to stop urine flow without you needing to think about it. It is often referred to as the internal sphincter. Another important structure is known as the pelvic floor, which is made up of a group of muscles. The pelvic floor muscles not only act as a sling to support the pelvic organs, but can also control urine leakage. It is a voluntary sphincter, which means that it contracts to stop urine flow when you consciously contract the muscles, and it is often referred to as the external sphincter. It is difficult to tell how much you might rely on your internal sphincter versus your external sphincter for your urinary control. With any prostate surgery, part or all of the internal sphincter is removed, and thus your normal ability to control urine leakage may be compromised because you then have to rely solely on the external sphincter and the muscles of your pelvic floor to control any urine leakage. Therefore, it's really important that you know how to use your pelvic floor muscles before you have the surgery, and this will give you the best results long term. Gaining an understanding of how to contract and exercise your pelvic floor muscles requires training, just like any other skill or exercise. Studies have shown, though, that men who underwent physiotherapy-guided pelvic floor training for at least 4 weeks prior to any surgery experienced significant improvement in the duration and the severity of early incontinence following their prostatectomy. One simple test you can use when identifying the correct pelvic floor muscles to use is called a flow stop test. When you go to the toilet, try to slow or stop the flow of your urine midway through emptying your bladder. If you're able to do this, you're squeezing the right muscles. Well done. Please don't do this repetitively. It's not an exercise, it's just a test to identify the correct muscles. Pelvic floor muscle exercises involve a series of held contractions of varying intensity, duration, and also in a range of different positions. You can self-palpate or feel when the right muscles are contracting, and there's a few other visual feedback cues that you can use to make sure you're doing the right exercise there. If you or a family member has an upcoming prostate procedure, please consult your physiotherapist well before the time for guidance on how to effectively train and strengthen your pelvic floor.